Well, so far it's been a mild winter, but it's still driving us indoors.
Yep, the familiar winter increase in COVID cases we've seen the past 2 years is back with us again this year.
However, overall community transmission in south central Wisconsin remains low. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is back with us. Good to see you.
Dr. Pothof.
Hi, guys.
What's the situation here in Dane County?
You know, relatively speaking, it's not too bad. So thankfully, RSV and influenza have kind of stayed low. We were worried they might pick back up again. COVID's out there, but not at a level where it's causing us a lot of problems. So from the viral disease standpoint, things are okay.
More people are testing positive, but they're dealing with it a lot better than this time last year. Is this the post-holiday surge that we've been watching for?
You know, I think it is, but it's not that much of a surge. So there's an increase in cases, but nothing like we saw in previous years where we saw pretty substantial increases after some of the holidays, which I think is really a testament to this idea that people have either been exposed to COVID, have some natural immunity, or they've been vaccinated, they've been getting boosters. So there might be a fair number of people who are potentially coming down with COVID. None of us know about it because they test at home or they're not tested at all. And the symptoms aren't so bad that they need to seek medical attention, so it just kind of goes underneath the radar.
Is there any, I heard talk of a possible nasal spray as a booster?
Yeah, so with COVID vaccines being such a popular thing, there's other manufacturers trying to figure out, is there a way that we can do COVID vaccines without getting the jab? So there's research and companies looking at, is there a nasal version, either drops of liquid in the nose or like a little puff of some liquid? They're even looking at oral formulations, which that would be really nice. Hard to say if they'll come to market, you know, whether they can make it through all those FDA trials and things like that, but alternative methods of delivering those vaccines would certainly be welcome. No one enjoys getting a shot.
And COVID's not going away.
No, COVID will be with us for forever. It won't be causing as much problems as it had the last couple of years, and hopefully with time it'll become more like influenza, but it's here to stay.
The CDC said it's very concerned about what's happening in China, though. Are you as well?
Yeah, for as much good news as we have around COVID, there's this wild card right now, which is China in crazy cases. And then that's not just bad for the Chinese people with lots of deaths and, you know, overwhelmed hospital resources, but it creates a good opportunity for a new variant. And what we don't want to see come out of China with all these cases is a new variant that does foil our vaccines and does cause more severe disease that could have the potential to make COVID have a little comeback. So we're hopeful that we don't see something like that coming out of China as they go through this massive surge.
Does that keep you up at night?
Oh, there aren't many things that keep me up at night. I don't get enough sleep.
Right, exactly.
I mean, is it a big concern, or
I think
something to watch out for?
It's a moderate concern, and right now our variants have been Omicron-based, and our vaccines have done really well against that, but you just never want to count COVID out. I remember back in the day, it beat me more than once as far as predictions go. So.
Well, you know, the symptoms of the flu and COVID they're undistinguishable. I mean, and I've just anecdotally, I have a lot of friends who have been sick, and they said, well, did you take a test? Do you know if it's COVID? No, you know, they just assume it's the flu.
Yeah.
And that's happening a lot. I mean,
but
is there a case to be made for you should take a test?
I think it's a good idea if you have respiratory symptoms, because they're all going to present the same early on: RSV, influenza, common colds, or COVID. If you get the test for COVID and it's positive, a lot of people will be in that higher risk group that would be eligible for medications like Paxlovid. So because we would do something different when we have that test result that's positive, I think it's a good idea, especially with easy availability of home tests.
Okay.
If you don't feel well, stay home.
Yeah, for sure.
All right, Jeff. Good to see you again.
Thanks.
See you next week.